From the News Channel 5 Network, this is OpenLine.
Hi everyone, I'm News Channel 5's Chris Conti here on OpenLine tonight. Our topic of conversation here this evening is going to be open enrollment. This affects a lot of people across the entire state of Tennessee, and especially here in the middle part of our state. And we are talking more specifically about people who are needing to enroll through the Affordable Care Act and healthcare.gov. Our guests tonight are Mary Moore and Sharon Baker. Both of them are experts in this field, I would say, right?
Okay.
we hope. So talk to me a little bit about some important dates. One important date has already passed, November 1st, and that's when sign-up started for healthcare.gov, right?
Right. So sign-up started, open enrollment opened November the 1st, and December 15th is the deadline if you want your coverage to start by January 1st, 2017.
Okay. And explain to people again, we've been through this the last couple of years, but why is it so critically important now that you get enrolled if you don't have health insurance?
Well, first of all, it's critically important so that you'll be covered, so that if you have an emergency or some kind of catastrophic situation that comes on with your health, you'll have insurance to cover you, and you can go to the doctor and get that taken care of. But second of all, it is the law. So you do need to have your insurance in place if you can afford it, that being that you're over 100% of the federal poverty level limit, and you can possibly qualify for tax credits, and you'll be covered for the year.
And there are now financial reasons also in case if you don't.
Yes.
I mean, it's not just you have to do this. There are you'll get hit with your taxes.
The penalty did go up steadily the first 3 years. This year it will be the same as last year. So the penalty for not having insurance if you're a single person is at least $695.
Wow.
It's either $695 or 2.5% of your income, whichever is higher.
Yeah.
So it can really go up and up from that point.
And most of the time people just look at that $695 number, but you can't disregard that 2.5% of your income, taxable income, because that could be higher than the $695, and a lot of times it is.
If your income is over about $48,000 for a single person, it's going to be higher.
It's going to be higher than that $695.
So.
Why has this has been kind of a difficult topic the last couple of years, and you know, there is now even more uncertainty, I think, with this moving forward, and so I guess what is your advice to people now? Just get covered, and then we will see what happens next year when we get to next year in terms of this new administration and some of the uncertainties there right now?
Exactly. So the election didn't change anything about open enrollment. So open enrollment for 2017 is still in full swing.
Right.
And that's the message that we're trying to get out to everyone, that nothing's changed about open enrollment. Anything that happens in the future, obviously, we don't have a crystal ball. We can't tell that. But the best way to show that you need coverage and want coverage is to go ahead and sign up. You have nothing to lose. The only thing you have to gain is coverage.
That's it.
You know, and we feel fairly confident that any changes that were to happen, there would be plenty of notice for both the insurer, from the federal government, letting people know beforehand if there were to be any changes. But we don't anticipate there being any changes in 2017. So
and one thing I think maybe people forget sometimes, you know, there's been a lot of rhetoric this last campaign season about maybe abolishing this completely or doing away with it or repealing it or something. But once massive federal programs are in place like this, it's hard to just take them away.
Right.
I mean, so even though President-elect Trump has talked about some changes, maybe some tweaks here and there, the likelihood that a program like this is just going to disappear now that it's been in place for a couple of years and there are 21 million people using it.
And that's the key.
You know, it's like this battle that's been going on with Social Security for the last 2 or 3 decades. You know, a lot of people want to get rid of it, but it's been helping people for all these years, and so to just pull the rug out from underneath people is likely not what the federal government is going to do.
I think there's a lot of things about the ACA that have been kind of woven into the fabric of America. I think there's a lot of things like the pre-existing conditions, that people can't be denied coverage because they have a pre-existing condition, and they can't be charged more because they have a pre-existing condition, or kids staying on their parents' insurance until they're 26. I think these are things that people really like, and it's something that we've come to expect over these last few years.
And I think, and there are things that, I mean, if you listen to President-elect Trump's 60 Minutes interview a couple of weeks ago, that first one he gave, those were two aspects of this that he said were going to stay in place. Even though there was a lot of talk beforehand that maybe things would be changing, he kind of backpedaled a little, and it seems like at least these two parts of the Affordable Care Act are probably not going anywhere. Those are very they are very big ones. I mean, people, you know, especially kids coming out of college now with a lot of student debt, and they can barely afford, you know, rent or food, you know, to be able to stay on their parents' health insurance for a little while is a big help for a lot of people. And then these pre-existing conditions. I mean, there were so many people out there with life-altering illnesses who couldn't get coverage. And now, you know, the insurance companies can't just turn them away, which is a big change for a lot of people. Again, we do want to remind people that if they want to call in, the number is 615-737+, 615-737-7587. Let's touch on one more thing before we start taking some calls here. So if people sign up for healthcare.gov for health insurance in Tennessee, who will be their providers? What kind of coverage are they looking at? What are some of the options that are out there right now?
Well, we have a few different carriers across the state, and it depends on what region you live in. For the kind of greater Nashville, Middle Tennessee area, we're looking at either Humana or Cigna as the carriers that are on the marketplace. In a lot of the rural areas across the state, Blue Cross and Blue Shield is still the major carrier. In the Knoxville region, Humana is the major carrier. So those are the three big ones: Humana, Cigna, and Blue Cross and Blue Shield. And what's available to you is just dependent upon what county you live in.
What how did these, you know, Blue Cross and maybe a couple of the others pulling out of the marketplace? How did that change things? Did it? I mean, you know, we've been hearing a lot about price increases, and what for the general maybe family or single person who's using Affordable Care Act or healthcare.gov. What kind of changes will they be seeing as they start to go through open enrollment right now?
My experience has been that, you know, Blue Cross and Blue Shield did pull out, so those people were referred to another company that gave a similar plan. Most of them have been directed to maybe a Humana plan, because a lot of the Blue Cross plans were like PPOs, preferred provider organizations, where they didn't have to have a referral, and the Humana does have an option that has a PPO, so they were likely referred to a comparable plan in Humana. But what I'm seeing is that those people that had the Blue Cross and Blue Shield, they come to me and they look at their options they have available to them now, and their premiums have gone down. So
okay, let's maybe open up the phone lines here for a minute. I know we have LD who is on line 1. That was not the right one. LD, can you hear me?
Yes, I can hear you very well.
And where are you calling from?
I'm calling actually from Davidson County, Metropolitan.
Okay, and do you currently have health insurance?
I currently am covered.
You are covered. Okay, and now where do you get your health care from, or your health insurance from?
Well, I don't want to state that. I just want to make a clear chant to the president of this Affordable Care Act enrollment.
Let me ask you, LD, do you get your insurance though? Do you get your insurance through work, or do you get it through the government?
Yeah, I'm just saying, I wish they would make a plea for it, which means in layman's terms, send out paperwork to everybody as the president of this Affordable Care Act enrollment, and leave something sovereign for the people, some stigma that would last in the Affordable Care Act, signing up, whether it be Blue Cross, Blue Shield, AARP.
What? So you want to leave what?
Well, I would love for that president just to come forward, whether it be whoever's the president, come forward with some sovereign movement for the Affordable Care Act or enrollment all the way around. Paperwork that goes out to everyone shows that it has someone that is standing for it. Everybody's touching on it, but nobody's standing up saying, I am this Affordable Care Act open enrollment president.
So are people standing up for the Affordable Care Act? I mean, we have 21 million people that are enrolled in it.
Sure. excuse me, sure, there are a lot of people that will share their stories on how the Affordable Care Act has benefited their lives. We do have people that do share the stories. I wish there were more that were being covered,
Yeah.
you know, through the mass media that, you know, stand up and people can actually hear people's stories that say, hey, I have the Affordable Care Act, this is how it helped me, this is how it benefits me, I want it to stay. I hear those stories all the time. I can't say that everybody hears them, but I do. I hear them all the time.
What are people saying when they come in to sign up? I mean,
Well, you know, actually, I get a lot of renewal people. So they've been in the Affordable Care Act plans for 4 years. I have a lot of people that I have dealt with since Open Enrollment 1 that continue to come back year after year and are so glad that they still have that opportunity to do so. And the ones that are coming in now, they're quite concerned. You know, what's going to happen? And I say, hey, you know what? We don't borrow worries from tomorrow.
Yeah.
Today you can get it, so let's get it. You'll have it for 2017. We'll worry about 2018 when it gets here. So.
And majority, I mean, is it mainly, would you say families or couples or single people? I mean, what do you see for the most part on the ground when people are coming in? Is
A
it
mixture of both, but mostly I'm dealing with individual one household,
one
person households.
One person households, not necessarily kids or.
I do see kids, but they're usually eligible for 10 care.
10 care, yeah. Yeah.
So we enroll them in 10 care.
What about you on the ground level? What are you guys seeing?
Yeah, I mean, because 10 Care and Cover Kids, which are also programs that we enroll into through healthcare.gov, they're open enrollment all year round. So we help a lot of those families at other times during the year. Right now, during open enrollment, it's mostly
Focusing on
the folks that are eligible for the Affordable
ACA.
Care Act. Insurance, so it's a lot of single people.
A lot of single.
Because if you're married, you're just that much more likely to have like,
insurance
Right.
through a
insurance
spouse's
through your
job.
spouse's job, if not through your own.
Right.
But there's also a lot of families, and sometimes the kids are on 10 care.
Yeah.
One parent's on employer coverage, maybe the other parent goes onto the marketplace if the family employer coverage is
Right.
too high. So we see everybody.
We do.
Okay, we want to remind people to keep calling in 615-737-PLUS, 615-737-PLUS as we continue our conversation about affordable care and signing up through healthcare.gov. We'll be right back after this.